Good evening. Can anybody hear me? Max?
Good evening. This is Joe Tyler here. We can hear you.
I'm ever so sorry. I wasn't sure whether I could make it to Paul by collecting my laptop in time from a meeting that I had with my work boss. So I apologise. If there had been time, I would have left early and I would have come to collect it and been there. So I
evening, members. Good evening, officers and members of the public. To the Health and Adult Social Care Overview and Scrutiny Committee, 26th of July 2021. Would you like to read the housekeeping notices, please?
Thank you, Chair. So please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council's website for a minimum of 6 months. Please could everyone present follow these ground rules. Only speak when invited to by the Chair. For those present in the meeting room, please use the microphones on your desk when speaking, and once you have finished, please turn off your microphone as this will assist with the live stream. If accessing the meeting via Microsoft Teams, please turn on your video function before speaking. And also, if you are accessing via Teams and would like to speak on an item, please do so by using the raise your hand feature in the Teams window. If during the course of the meeting there is a move and a vote, the Chair will call out each committee member's name and will ask the member to respond with a for, against or abstain. This is for the purpose of the video broadcast. For those in the room, please note that if the fire alarm sounds, you must exit the building by way of the nearest available signed fire exit route and make your way to the ground floor of the multi-storey car park. And finally, please ensure background noise is kept to a minimum and that mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you, Chair.
Thank you, Joe. Now we have some committee members here in the room, and that includes myself, Councillor Edwards, and Councillor Evans, the Vice Chair to my right, Councillor Diana Butler, Councillor Tony Trent, Councillor Marcus Andrews, and we've got Councillor Susan Phillips dialing in and Councillor Kieran Wilson dialing in, and our portfolio holder Karen Rampton's dialing in, along with Louise Bate from Health Watch over there. So hello Louise. We've got Phil Hornsby here in the room with us, who's Director of Commissioning for People, and dialing who's and Karen Tonk, Deputy Head of Democratic Services. So if anyone's been missed out, if they wouldn't mind raising their hand. No. I'd like to move on to the agenda items for this meeting. Apologies. Joe, do we have any apologies for this meeting?
Thank you, Chair. Yes, we have received apologies from Councillors Chris Matthews, Mark Robson and Dwayne Farr, and subsequently with item 2, Chair, substitute members, and we have with us today Councillors Tony Trent and Marcus Andrews substituting in for the meeting. And if I may, Chair, just to add on that, as you say, Councillor Kieran Wilson and Councillor Susan Phillips are joining us virtually, and they have been informed that if any matters arise that require a vote, due to the relevant legislation that states a member must be present in the meeting room to cast a vote, they will not be able to participate, but may input and add comment or question as and where they wish to. Thank you, Chair. I'll hand back to you for item 3.
Thank you, Joe. Do we have any declarations of interest? Thank you, Councillor Evans.
Oh, for transparency, I declare that I'm a bank employee of University Hospitals Dorset.
Thank you. And Councillor Johnson?
I'll just shout. Oh, same again. I'm an employee of University Hospitals Dorset.
Thank you. Anybody else? No. Okay. Agenda item 4, confirmation of minutes. Unless anyone indicates otherwise, do the committee agree to confirm the minutes of the meeting held on the 26th of May 2021? Councillor Jones.
Yeah, hi there, Chair. Just to let you know, I'm actually missing off the list of attendees for the last meeting. I was definitely here, so I know I'm easy forgettable.
Chair, if I may, thank you, Councillor Jones. That was an accidental omission. I can assure you, we'll make sure that that is corrected before signing. Thank you.
Yeah.
Councillor Butler.
Yeah, just a correction on the
point 136, page 14, special educational needs and disability. It should be SEND. Thank you.
Thank you. Councillor Trent.
Yeah, I will abstain for obvious reasons at the meeting, so I shall abstain.
Thank you. Can I just add that on item 134, the adult social care, not to anything with the minutes, but an excellent seminar was held last week for all the members on the adult social care contact centre. So that was very enlightening. So thank you for that. But I think everything else is okay there, Joe. Agenda item 5, public issues? Are there any public issues for this meeting?
There are none, Chair. Thank you.
Oh, I've just noticed Louise Bates said she's also missing from the attendees. Sorry, Louise.
No problem. Thanks, Joe.
Agenda item 6, the action sheet. Unless anyone indicates otherwise, does the committee agree to note the action sheet, which tracks the decisions, actions and outcomes arising from previous committee meetings? All agreed? Thank you. Agenda item 7 is the market position statement. So can I ask Phil Hornsby to intern, please? Thank you, Phil.
Thank you, Chair, and members. You should see now a presentation that's come up on the screen. Is that? Can everyone see that? Good. So this is this item's entitled market position statement, and that's a document that's intended to help our social care market providers understand what we currently provision we commission, provision we might need in the future, and align to our vision for adult social care. And it also picks up issues that the NHS might have in terms of commissioning for things such as care homes or meeting the needs of vulnerable adults. We decided that in setting out the approach to this, which fits in with the Care Act 2014. Care Act 2014 requires us to have a vibrant and sustainable care market, and not just for those services that we commission ourselves as a council or the NHS commission, but also for people who self-fund their own care. And we need to help people understand the choices out there, not just now, but going forward in the future. So we identified that we need to give some clearer messages to the market, what the future adult social care needs would be through a market position statement. A market position statement was seen by the Department of Health and Social Care as one way of being clear about the messages we want to give. And it's been developed by, in conjunction with the Institute of Public Care, who are part of Oxford Brookes University. And they have been leaders in this field. Market position statements aren't new. They've been around for a number of years now. And they were part of the development programme to get market position statements up and running. And with support from them and the LGA, the Local Government Association, they received some funding towards the development of this and the two strategies that we'll talk about later this meeting. So the market position statement is really just a high-level strategic document that sets out our vision. What are the needs that we might be trying to address as we move forward? What's the provision we currently have? How do we access that provision? What do we need in the future? And then what kind of key messages do we want to give to our providers? So some of the fundamental things within this, we engaged with a group known as the Sector Leadership Group, which is a group of leaders of care providers across the wider DOS, not just BCP. It also includes the voluntary sector, so it's got care home providers, those that provide home care, supported living services to people through community developments and supporting them in their own homes, but also the clinical commissioning group, the NHS clinical commissioning group, Dorset Council, ourselves as BCP Council, and that probably a membership of about 15 to 20 leaders across that. So the feedback we got from them is what should we include within the market position statement? And they said it should cover the whole of the adult population, not just be focused on older people or younger adults. It should really try this positive way that it isn't just about people who have needs, and there's been a lot of criticism of the care market, and you only tend to hear the bad news stories rather than the good news stories. It shouldn't just be a statement about needing less residential care, and that'll become clear as we go through the document, but as much about the messaging to say this is about creating greater independence for people in their lives. And it should be keep revisiting and engage with the commissioners in the room to say, what is it we want to do? How do we want to do it? How can you help us? What influence do you need to have in this? But also act as an invitation, not to just to think of the traditional ways of work and care, but to think differently and challenge each other about what the future might hold and what are the new types of care going forward. So what are the key messages that are coming out of the market position statement? That we should be enabling people to live well, safely and independently, and that we need to really grab the strengths of those individuals and their communities and link it to the asset-based community development approach that the council is working with. And then we should also be information, advice and guidance that are available, so that people can make their own choices long before they might need adults. And increased emphasis on outcomes. What difference do we make to your lives with the services that we do provide? What impact are we having on you? And how is that helping you to live safely and well? And just continuing on those messages, we need services to meet the needs of an increasingly older population, but not losing sight that we need appropriate support for working age adults, particularly those with disabilities. That we are clear that we want to reduce the number of placements that we're making into care homes because we want to keep people in their own homes. And that means the demand for care at home will rise because we want more people to receive that kind of support. But as their needs increase, how can we continue to support them? And that includes the support that we can get from community health services and primary care. There's a greater demand for housing that offers integrated care and support. And the example used here is extra care housing, and there's a commissioning strategy on that later on the agenda. And that we want providers to think about how can they involve communities, how do they engage the communities around the services they supply, so that we can maximise the health and well-being of people, link them into their communities, social activities, leisure activities, and that they're not just maintained in an environment that is restrictive to them, but how does it open up the world around them? So that's really a quick romp through the market position statement. You've got a report and the position statement itself. Chair, questions I'm happy to take.
Bill, has anybody got any questions? I know I've got one, sorry. On page 29 of the report, the data on the packages, 51 adults using direct payments, etc. Now, are these all that the council are helping, or does this include the self-funders as well?
Thanks, Chair. That's a good question. This is BCP funded packages of care, so it's where we've commissioned services for people.
Right, so we don't know how many self-funders that are taking up some of these packages, perhaps using private healthcare and things.
We can hazard a guess, but unfortunately it is a semi-educated guess. It's very difficult to get information from the care market, and there are a plethora of providers out there. with any accuracy that says how many self-funders there are. But if we worked on as at least 50% purchased is purchased by self-funders, but that is just an educated guess rather than a data evidenced piece of work.
Thank you. Councillor Evans?
Thank you, Chair. So on page 30, it says we currently spend more than the average for England on care of our older people, but support less percentage-wise. And we spend more on long-term care for each individual than the average. Can you explain why that is, please?
Yes, some of that's driven by the market in terms of costs. The cost of placements, particularly for residential care, is driving our average against the England average up above that. I will come on to that in the care home commissioning strategy, but on average, we've seen our prices increase by between 5 and 10% year on year, whereas that's not what's driven by inflation or some of that's driven by the national living wage, but that doesn't account for why it's different than the England average. Cost of living in the BCP area is high. Accommodation costs, people's, if you're trying to buy a house or even rent, that does drive up costs, which means the providers are having to pay their staff more than the national living wage, and that, as some councils might be able to do, that can allow them to constrain their costs. But and we're being led by the market rather than the market being led by the council or the CCG.
Thank you. A second question, if I may. You've mentioned the budget pressures that we're going to be facing in the coming years. 4.368 million 21-22, 8.641 next year, and up to 10.8 million the following year. And that's despite the identification of significant savings. Can you explain how we're going to mitigate those pressures?
The commissioning strategies that we'll talk about in future agenda items at this meeting will hopefully help set out how we hope to mitigate some of those. If you're okay, if we wait till then, I don't want to steal the thunder, but we'll hold that question and I'll come back to that. I think but just in a broad terms, there are a range of actions that adult social care is looking to take, which is as much about managing demand. So trying to support people earlier, which reduces demand on high cost services later down the line, and working with health colleagues around prevention, health prevention and support.
Thank you. Sorry about that bit of a glitch on the system there. I think I was halfway through a question for Phil on the Bournemouth, Christchurch and Poole is currently below the average for England in terms of the number of people with mental health problems who are living independently. And I just wondered what the figure, the national figure was that was being compared against. And I think Phil was halfway through his answer and we lost everybody.
And I don't think I was on microphone, Chair, so people wouldn't have heard anyway. Yeah, this national data comes out annually around about September, October time, which is a collection of all the data that councils submit and community health providers, because some of this is driven by the work of Dorset Healthcare. What it relates to and why it's difficult to give us a comparison at this moment in time is the numbers of people, or percentage of people with mental health problems who are living independently, so not in a care home. So they're living in their own homes, either with family or independently. And we have areas to improve on that because we've got too many people who are in a care setting rather than in their own homes. I haven't got the national figures in front of me, but I do know it's an area of improvement for adult social care and part of our adult social care strategy to increase that number, or that proportion of people who are able to live independently with or without support.
Thank you. Councillor Evans, did you have a question?
Thank you. Yes, it was about the Home First funding. I believe that's coming to an end, and I just wondered if you're able to provide any update on where we are with that, please.
So the Home First funding, which was which came through when COVID first came upon us, is some short-term funding, always intended to be short-term funding, which supports people to be quickly discharged from hospital and put on a recovery pathway so they can then go home after a period of time. It was initially 6 weeks, it's now reduced to 4 weeks, but there's a national cap on that, and that cap is only intended to run for another 3 months until September, and then we've got no word that there's that. So as a system, that's health and social care, we are looking at how we can maintain the Home First approach, but use our existing funding to accommodate whatever changes we need to do to systems so it becomes sustainable in the longer term. What we would also hope is that the government, in its review of adult social care funding, takes into account the additional financial pressures that this approach puts on us as a burden. So we are hoping that there's a longer term solution that comes through the government's green paper or adult social care funding paper.
Thank you. Could I just ask something about quality on page 33? There was a couple of items there where compared with our nearest neighbours, we were below average. I just wanted to note that it said the proportion of people who use services who find it easy to find information about support is below average. And this worries me a little bit because as we go more and more digital, these are the sort of people that we don't want to leave behind. Those that are not computer literate or can't access a computer or have someone that can look up the information for them. So I would certainly like to see that flagged up with that there are leaflets and doctors and so on, that these people can access this information. So that was on that one. And also on page 35, sorry, you haven't got it in front of you, I know, where it says living in a community can bring problems. Let's see if I can find that. I just wondered what those were, sort of.
Chair,
I think sometimes it's to do with the technology, with that, but it just said that that some of them find it difficult living in the community.
Chair, I wonder if I can respond on both of those points you just raised. So in terms of information and advice, we, as part of the council's overall approach around digital, but the broader offer of information and advice, you referenced the Adult Social Care Contact Centre presentation that members had access to last week. That is one of the areas where we're promoting and pushing through how we get people access to the things such as fact sheets, leaflets, information, and of course through GP surgeries, libraries, etc. Of course, we're moving into a more digital age, so we're looking to enhance the offer around information and advice, particularly for people who fund their own care, so that they can make choices that are based on good evidence and good information. So that's one area, and yes, absolutely, it's an area that we want to focus on, and we will move forward on even more so than we have more recently. The other reference around people that might struggle to live in the community, sometimes that's around isolation and loneliness. You know, if you only see people infrequently, once or twice a week, even if your care provider might be the only human contact you have, which is a reference back to how do we increase the social contact that people have around and within their communities. So how can the communities help and encourage people to be engaged with them, be good neighbours. It's not a term that's used nowadays so much, but that's that approach of just being aware of each other and who there's next door to you and around about you, and what are the things that go on in your community, and how can the voluntary sector also help us with that. So I think that's the reference to the difficulties in living in the community, and it's that access to other services.
Thank you. Has any members got any questions? Councillor Trent.
Yeah, thank you. In the section on housing, it talks about an additional 1,500 units of specialist accommodation for primarily older people, and I'm wondering whether that is being looked at seriously, because I noticed that there were lots of sites allocated in the local plan for community accommodation, specialist accommodation, but there's one site, for example, in the ward I represent, which is getting ever closer to being developed for retail, because nobody is utilising the specialist accommodation. So if we need 1,500 units of specialist accommodation, and there are units already in local plans that aren't being used for that kind of accommodation, I'm wondering whether there's a little bit of maybe a missing link between the needs here and the allocation of land, or there seems to be a disconnect between the two. So yeah, just a general query on that.
Thanks, Councillor Trent. As we, not the next item, but the item after that on the agenda, the extra care housing strategy will address some of those areas that you've just mentioned, but it's also the specialist housing for vulnerable young adults who might have particular needs, adults with disabilities, mental health problems, and some of that's about are the sites suitable in terms of their location, public transport, what's around them. But we're working closely with housing in terms of the emerging housing strategy, and I'm also engaged with planners around the future local plan about how do we make sure that all of the accommodation needs that we have as adult social care and children's social care for that matter are wrapped up and captured within those developments. And I will look at those developments that you've highlighted were already in the local plan for specialist accommodation, to understand why they're not being picked up at the moment.
Yeah, well, one of the sites, talk about location, is on the edge of a major retail thing. It's about as close to the hub of local bus transport and public transport, and also railway transport, that you could possibly be. Yet the land which has been earmarked for that kind of use for the last 3-4 years still isn't being used for that. use, and major retailer is just trying to get hold of it and get it developed for housing. It got refused last time by the skin of its teeth, but here's a site in a major hub area that just isn't being used for the purpose which it was put aside for, and nearby in some of the sites up for recognition in the local plan, there are other sites nearby that aren't perhaps as good, that are also, because of constraints on where it is, that is put down as a possible use. So, you know, within the ward I represent, there are several sites that could be adapted. Some are more suitable than others. And as I say, this particular one, which is on the edge of the Paul Commerce Centre, with the ability to access in about 3 different directions, and as I say, massive public transport hub there. You know, you're sitting there waiting to be used for the purpose to which it's in the local plan for. So just really want to put a marker down on that.
Thank you, Councillor Trent. Is that everybody? Yes, Councillor Johnson.
Thank you. So just correct me if I got this wrong, are in care that don't need to be in care.
I want to be careful how I respond to that, because that suggests so what we may have placed themselves into a care home setting sooner than they needed to. So self-funders who might have thought they're feeling lonely, they're maybe feeling unsafe in their community, and they've made the choice, often without really thinking of the other options that are available to them, such as extra care housing or sheltered accommodation that would still be able to meet their needs, but they've placed themselves into high cost care home quite quickly, and that depletes their assets, their financial assets, very, very rapidly. It might be the right decision for some people. They've just perhaps made it a few years earlier than they needed to.
That was what I was trying to understand, really. Why would somebody do that? Is it because their home is not particularly nice to live in?
Yeah, it could be too large for them.
Yeah.
Movement. It could be that the family are encouraging them because they're worried about their loved one, their relative living on their own. There could be a variety of reasons that our social workers would be able to cite back and explain some of the decisions that people are making. We already try to work with people who are from their own care, if they're in the hospital, to just talk to them about their options, not to coerce them into making choices, but to think about the choices and offering to support them to make those choices if they're so wish. People are quite fixed on what they want to do in their lives. The pandemic has actually reduced the number of people as self-funders who have made the choice to go into residential care, and that's driving quite a lot of vacancies in the market.
Thank you.
Okay, thank you. Yes, Councillor Andrews.
Yeah, in the report and elsewhere, I see references to population demographics, particularly it says the 2011 census. So obviously we've had the 2021 census. Obviously, lots of people up and down the country are waiting for that information to be disseminated and spread and shared with everybody. Can we be assured that on this, where trends and projections have been making use of the 2001 census information, as soon as more up-to-date information is available, that you will update your advice and recommendations? Because clearly down here it's a retirement area, and if we are getting more people retiring down here, more people needing social care, and it's likely to increase, we clearly need that information as soon as possible.
Yes, thank you, Councillor. You're quite right that we will update our information once we have, and that information that comes from the 2021 census tends to come in a drip-fed way. It doesn't come in a big rush, so we'll get that over the next probably year to 18 months in different dribs and drabs. We will update, and this market position statement is seen to be a living document. It isn't just a one-off every 10 years. So we said within 12 to 18 months that we'll review this and make sure that the information is current and relevant. the projections that are in at the moment are based on some, I want to say scientific data, but research and evidence that's tracked the trends of increases between censuses. So it's trying to predict the future, but it gets refined every time a census comes out. So yes, we will, if I can just assure you that we will reflect that in any of our plans going forward.
Thank you, Councillor Evans.
Thank you. Lastly, could I put a plea in that we come up with a better name for informal or unpaid carers that actually gives them value and respect? I'd like to suggest perhaps something like recognised or registered carers. I'd be interested to hear your thoughts.
If I may, I'll take that away. We're currently revising the carer strategy, reviewing the current strategy and coming up with a new carer strategy. But I'll take that back and speak to the leads on that and ask them to think about a different terminology.
Thank you. We were asked to note the contents of the market position statement, and I think we've done that. Yes. So I think it leads nicely on to agenda item 8, the care homes for older people commissioning strategy. And Phil, you're going to present this item as well. Thank you.
My apologies for not using the mic. Again, this care home for older people commissioning strategy has been developed with the Institute of Public Care with LGA support. Extensive collection of data and analysis of that data. But we've had limited consultation because of the pandemic, but we've consulted, engaged with care providers, and we've asked them to respond. It was an online engagement with them, session and response. I just want to assure and reassure members that any developments, individual developments from the strategies that I present tonight will be worked through with people, so that people themselves, people who receive care, relatives, carers and professionals will all input into the co-production of those individual responses to the high level issues set out in the strategy. So just some background. The pandemic has had quite a significant impact on care home providers and their finances. They faced additional costs. They have had some of those costs offset by short-term government grants, but that doesn't change the fact that they have got increased costs. Over a number of years, we've seen an increased numbers of people with dementia who are supported in care homes, but are also in the community. An increasing number in care homes, particularly because we've tried to keep people at home for as long as is reasonably possible, support them with care and other support mechanisms, including equipment, technology, which means that more and more the people that we as a council and the NHS place into a care home setting have quite complex needs. And quite often that's cognitive dementia needs, where because it might no longer safe for you to live on your own. You don't have the 24-hour support of family or other carers. So that might explain in some ways why fee levels have increased. To go back to the question you asked earlier, Councillor Evans, that we have seen a significant increase, but that isn't all of the story. The market is leading. It's become a supplier's market, and they've dictated a lot of the prices to us as a council, and we'll come on to how we're going to address that later. But what we've seen just in the last quarter, the last 3 months of this year, is that occupancy levels are down between 20 and 27%. So that's quite significant. that's not the same for every provider. We've just got to look in the context of some providers have chosen to close their businesses, some care homes, some because they just feel it's become too much, some because they're struggling to meet the standards set by the Care Quality Commission and the commissioners in terms of the council and the clinical commissioning group, and others because it's been really difficult to recruit staff. So they've made a conscious decision to exit the market. So as they run down their businesses, the vacancies grow. And there are a couple of care homes that are still registered but are dormant, so they have no residents, but they still get counted in the numbers of vacant beds. So that could be seen as between 500 and 1,200 beds are vacant at this point in time. And that's quite a wide range because of the things I've just said in terms of the decisions that providers are making. So active providers, active homes, there are probably around 500, 600 vacancies at the moment. And profits in general have slowly declined over the last decade for providers, but that isn't all providers. So I wouldn't want members to think that every provider is not making a reasonable profit. Some are starting to struggle for financial viability though. Our local profile of provision, actually, BCP has a high number of care homes, given when you look at us nationally about the proportion of people who go into care. So we're probably around in somewhere in the middle or the top 40% of councils who place people into care homes. And that's partly driven by the market. There are a lot of care homes out there, less than there were a year ago, but still a lot. 113 for older people. That's probably, we probably have 30% more beds than would be the average nationally of older people's care home beds. And some of our complexity as a market is driven by the area that we live in. So it's a nice place to come and live. We are an importer of people, so people do choose to live in the area, and care is commissioned by other councils, neighbouring councils to Dorset and Hampshire, quite often because of our high number of beds. So there's a wider choice. And as I referenced earlier, probably 50% or so of people who reside in a care home are those that fund their own care. And in the longer term, as their resources run down, once they hit their capital limits, so there's a nationally set capital limit, then they approach the council for funding. And you're probably aware or realise that it's then very difficult to ask someone to move who might have lived in a care home for a number of years. And it's quite difficult if they've got conditions, long-term conditions, particularly dementia. It can be quite unsettling and can lead to a reduced life expectancy to move them at that time. But having said all of that, there are not that many in terms of the overall numbers of people that we support in adult social care who go into care homes, but they are a significant drain on our budget and also the NHS budget. So we have high prices and low volumes, but that does drive significantly the overall council finances. But on a good note, that just under 90% of care homes are rated as good or outstanding by the Care Quality Commission. So that's a good proportion and puts us in probably the top 15% of councils across England. So as we look forward, we do realise that technology is likely to have a much larger part to play in care provision, whether in a care home or in someone's own home. We know quality is not a major issue of concern, but we're not going to take our eye off that ball. We want to make sure that continues. We do recognise that our care home fee structure needs reviewing. We need to be able to work with the market to set a fee structure that works for them and for us. And we need better live data collection and analysis of that data, so that as we're making placements, we're using live data about fee levels and occupancy levels, so that we're not scouring constantly the market to try and find the right care for people. So the key commissioning objectives that are in the strategy are to reduce the number of care home admissions made through the council and the NHS, review and revise the commissioning arrangements with care homes. That includes the contracts and the fee structures, and apologies for the extra full stop in there. How we can work more with the care homes that we have across BCP in developing and maintaining the workforce, and that includes recruitment and retention, because we're finding, particularly at the moment, that that's a pressure on the market wherever they are in adult social care provision. But we also want to better support care homes as they continue to provide safe, effective and high quality care. And there are initiatives already, some being led by the NHS in terms of enhanced health in care homes, where we're putting additional equipment in and support, clinical support, to make sure that they can care for the people that they have and avoid the need to go into hospital. And then to reduce the number of unnecessary care home admissions by self-funding residents. And I talked a little bit earlier about are people making the right choices at the right time. Thank you, Chair.
Thank you. Members, got any questions? Councillor Jones.
Yeah, thank you, Chair. Yeah, so you said in the report about the image rated good or outstanding by CQC. What action is going to be taken against those that are performing poorly or below that acceptable standard?
That's again a really good question, and thank you for asking it. There are two, well, it's probably three players in this, three different organisations. So the council has a service improvement team which does do routine monitoring visits to care homes at least once a year. It was stalled last year because of COVID, but we're back up and running with face-to-face inspections. That includes us looking at their policies, the procedures, observing their practice, checking that they administer medication properly, looking at how they manage the home. Is it well led? Is it well supported? And do they have the right staff with the right training? That's broadly based on the work that the Care Quality Commission do. So the Care Quality Commission are the regulators for adult social care homes. Their approach, they've got to have, they will inspect and they will judge care homes, rate them as good, as outstanding, good, requires improvement or inadequate. And so they can impose sanctions as a regulator. Ultimately, they can remove the registration of that provider, or they may seek them to have an improvement plan. So we work quite closely with the Care Quality Commission on those improvement plans. So our own monitoring and CQC's inspections, you will see a link between them in how we seek improvements and how we monitor progress. Ultimately, we can remove our contract from them, so we would not place our own placements in them. That doesn't stop them taking self-funders, of course, and that's where CQC's regulations come into play. And then the third organisation is NHS CCG, Clinical Commissioning Group, who have a quality team who monitor the quality of nursing provision, and we work really closely with them on joint visits into nursing homes. Similarly, they will inform us if they feel that the nursing provision isn't good enough, that the clinical oversight isn't strong enough, and we'll jointly monitor an improvement plan that is developed by the provider. But we will we'll point them in the direction where there's really good practice and ask them to consider either bringing in support or improving themselves. So that's the kind of level of oversight, but also the level of sanctions and improvement that we expect from providers, which is part of the reason why we've got a high proportion of good and outstanding, because we work in a supportive way, and we only bring the stick into play if it becomes a case that providers aren't willing to engage and improve. Thank you.
Thank you. Anybody else? Councillor Evans.
Thank you. You've already highlighted the need to drastically review the rate setting strategy because it seems completely unrealistic for the current market. One thing, I realise we're trying to reduce the number of people in residential care supposedly who don't need to be there, but we do talk about wherever possible and where they choose it, we'd look to place couples who both need residential care in the same care home. I just think that shouldn't be a requirement that they both need residential care. There should be some way that a married couple who's been together for many, many decades should be supported to be able to live together in a care home, even if one doesn't actually require the additional support. I'd be interested to hear what you think about that.
My challenge back would be who would fund that care and support. So the council's already struggling to fund people that have the eligibility that require a care home setting. I understand and can be empathetic towards the view that couples should stay together wherever they can, but this is the public purse, and we can't spend money. These are nationally set eligibility criteria, not locally set. So we do need to be careful about how we do that. We will support visits and contact, but if someone doesn't have eligible needs, then the council can't be seen to step in with the funding for that. I think the CCG would take the similar line.
Thank you. Councillor Trent?
Yeah, further on from the last question, a few years ago, and it's probably still out there, there was what they described as Part 2.5 housing, which was somewhere between residential care and standalone care, which people who were sort of in between the two would go to. I think there was a scheme in Pokesdown somewhere along those lines. And I'm wondering whether they still exist and whether they are perhaps potentially the kind of place where the people as described, you know, the couples where one has a high need and the other hasn't, could be accommodated. As I say, it was something that was a little bit more sort of overseen than ordinary council or PHB type housing, but it wasn't out and out fully care home, but it had, you know, a lot more presence in it. And it just seems that because the point that LJ made, when you've got a couple that have been together a long time and, you know, one of them's maybe slightly better than the other one, but surely the thing you need to do as far as possible is to keep them together. And I would have thought that Part 2.5, if we've still got those, would be an appropriate you know, sort of solution to a problem like that.
Thank you, Councillor Trent, and you're really raking through the old legislation there. So I think that was part of the National Assistance Act, Part 3 care homes. Part 2.5, I haven't heard it described like that, but I quite like the description. I think what you're describing is extra care housing. So that's accommodation where you have your own flat, but there is on-site 24-hour care and support if you require it. And that's the subject of the next paper that's on the agenda. So I completely agree with you that we want to keep people together for as long as possible. And where we can, we will facilitate that in their own home. It's so your point's well made that there are approaches that we can take that if the choices are made at the right time, we can keep couples together. But unfortunately, it's not in a care home setting unless they both have the relevant needs.
Thank you. Councillor Butler?
Yes, you mentioned recruitment and retention of staff. I think training and appraisal of staff is really important, and I've seen in the past in care homes where staff have been given minimal training, but they're not actually paid for it. They're expected to turn up in their own time and attend a session. Now, I don't know how widespread that has been or whether it still goes on, but how can we check that adequate training is provided and attended by staff?
Thank you, Councillor. But that's one of the areas that both the Care Quality Commission and the two service improvement teams, the Clinical Commissioning Group and the Council's own service improvement team, do look at. So we will ask to see the competencies and training records of staff and understand if they've got the right levels of skills for the particular needs of that care home. And we also provide training ourselves that they can access at a subsidised cost or for free. becomes partly funded through an adult social care training grant. And they also have their own access to other resources, and of course places like the college provide the care certificate training as well. So care certificate training gives you that broad basic understanding of care, how to do it, what you need to take into account, and understanding of things like dementia, how to move the moving and handling for someone safely and carefully. So we do check that. Ultimately, it's on the provider and the Health and Safety at Work Act to ensure that their staff are appropriately trained, and that's what they need to do and satisfy both CQC and the HSE, the Health and Safety Executive, if there's an accident. I'm never feel that we can be complacent and expect it just happens by chance. So we do want to check and be assured ourselves that the right training and support's in there. So hopefully that answers your question. The second part where you said about they were asked to attend in their own time, that it's really difficult for us to change the approach that providers take. We can't make them pay their staff. What we can do though is they can access support through our funding, which enables them to get the free training. So that means they could pay for that member to attend in paid time, if that makes sense. We do ask them the question, and generally they say that they do not expect staff to attend in their own time.
Thank you. Anybody else? Question? Phil, could I just ask? I mean, I think you've got some really good objectives there. I just wondered, on objective number 9, to promote and improve the use of technology in care homes, could you just give us an example of what you sort of mean by that?
Yeah, so quite often care homes do use quite a bit of technology at the moment. So things like falls detectors or bed sensors, where people are maybe getting up in the middle of the night, and if you've got a 60 or an 80 bed care home, you need to know that someone's got up. They may not use the call system, the nurse call system. So if they've got particularly someone who does wander, who is at risk of falls, then things like falls detectors and bed sensors we use. But where I talked before about how the NHS is working with care homes around things that would tell you if people's respiratory function was within the right parameters, that would stop them exacerbating into a need for an ambulance to be called, so they could intervene earlier. They could ring 111, or they couldn't get primary care to attend. And that at the moment is limited. It's not in every care home, but we're wanting to expand the use of that and make it more the norm than the exception, and how we can support that either through funding or access to equipment. And we're looking in adult social care about how we can use technology more effectively overall, both in care homes and outside of care homes. So I think the first bit is, how do we monitor people's not vital signs, but how do we monitor their usual activity, and is there something that we need to do in addition? We might need to change the pattern of care about the time someone's seen. And there is so much technology now that it's difficult to pinpoint everything that we might use. But we're also expecting care homes to use more digital case recordings, so the notes are easily shared amongst the staff who are on, so they're not locked in a filing cupboard in the manager's office, so they can see them live. They know what the care plan is. They can put their observations on there, and they record issues that have happened during a shift. So it's really just trying to promote the digital age more.
Has anybody else got any questions? We are asked to scrutinise and comment on the contents of this report, and also make such recommendations to the Cabinet as we see fit. Has anybody got any recommendations, or are we quite happy with the strategy going forward to the Cabinet as it is? So, yes, yeah, okay, that's lovely. Thank you, Phil, for that. And you could have a glass, sip of water. because you're agenda item number 9. Extra care housing strategy for vulnerable adults and older people. Thank you, Phil.
Thank you. And I was slightly remiss when I talked about the care homes for older people commissioning strategy. So I'm going to put that right now, that just to say that if we consider these strategies in the light of some of the action objectives within the big plan, and also within the corporate strategy of the council and the adult social care commissioning strategy. So, you know, if you think about vibrant communities, fulfilled lives, and enabling people to live well through quality social care, the thread through to our high level corporate approaches are key for us here as well. I'm just going to skip over this slide because it's the same as the one around the care homes. So worked with IPC, with local government association support. I thought that, and partly Councillor Trent, hopefully this may help in describing that part 2.5 description. What do we mean by extra care housing? So it's housing that was primarily thought of and developed around older people, so that occupants have specific tenure rights. So you have a tenancy, you either own or rent the property that you live in. Self-contained properties with kitchens, bathrooms, bedrooms, lounge area, and where there are agreements in place that cover the provision of care support with domestic, social, community or other services. So it's seen as a community, which should be seen as a community. What I would broaden that description out to is that it can also meet well the needs of younger adults, working age adults with mental health problems, with disabilities, with vulnerabilities that places them perhaps higher risk to live on their own in the community, but in a community where there are a larger number of accommodation units and there's that on-site care and support, you can live quite well and in fact improve your quality of life. So locally, we've got the reason for putting that description in there is because quite a lot of schemes, accommodation schemes, will class themselves as extra care housing, but I would argue that they don't quite fit that criteria of that broader care and support on site 24 hours a day. So we've got a limited number of extra care housing schemes across the wider conurbation, and that's 560 units or so across a number of schemes. Some were purpose built, so there are schemes in Bournemouth and Christchurch and in Poole that were purpose built as extra care, but some were converted from sheltered housing stock. So there was a time when people said, if we put the care and support in, we can use this stock differently. Quite often they're either in bed sits or small units that don't really lend themselves to people's frailty or disabilities. And we've got a large number of retirement schemes, and I'll not mention any names, but if you think about some of the large national providers who provide luxury apartments across the BCP area, but generally don't provide care and support, or the care and support is limited. And if your needs get to a certain level, then you're asked to move accommodation. That's not what we really want to achieve. They have a place, and that's not to knock them, but not to provide care and support for our most vulnerable adults. So the commissioning strategy sets out some key messages. We want to expand the amount of extra care housing provision that we have across the BCP area. And I've said that would suggest at least 1,000 units. It does reference 1,500 units in the strategy, but I think if we aimed for 1,000, that would be a good place to start. That if you look at care and housing provided together, we can meet the needs of quite a wide range of people and groups, that we don't need to limit ourselves to older people. And a good extra care scheme really does depend upon the quality of the accommodation. If you get the right accommodation with the right space and access to the right community facilities within and around it, then you can really help people thrive and live a long and healthy life. And of course, that does include the quality of the care and support provided. And that care and support isn't just about social care and support, it's also about housing management, about being a good landlord, around how you support people to maintain their tenancies and help them with issues that they might have. It's important that adult social care works with housing and other organisations to develop new provisional schemes, that we can't do everything ourselves, although we can have a good crack at that. And we're already, and Tracy Kybert, who's presenting later on the agenda, has been part of the work in developing the extra care strategy, and Tracy has a role that cuts across housing and social care and health. So they work very closely with Tracy on our developments. We want developments that will be able to accommodate adults of all ages with varying levels of need. So not everybody needs it. The point about extra care is it can meet needs almost up to the level of residential care, not nursing care, but it can meet quite high levels of need. But you wouldn't want everyone in that scheme to have that level of need. You want a mixture of needs so that your community is supportive and helpful of each other. But quite often the people with a low level of need might have a condition which means they are likely to deteriorate over time, that they'll need more support. Again, technology, particularly in extra care housing, can have a big role to play because it promotes independence. You can ensure that things like video conferencing with your GP or other professionals can take place. You can access other technology that will open doors automatically. If you have a disability that means that you can't get to your door, it might open windows, it might close curtains. You can use technology in a way that means you don't need someone to come in to do those simple tasks that are now beyond you, but that care and support's there just if you were struggling or your technology breaks down. It's not to replace personal care. We're not seeing technology as being something that takes away the need for human contact. It complements their human care. And we need to really lift the profile of extra care provision across Bournemouth, Christchurch and Poole. I don't think it's brilliantly well understood by the general public, but also by some professionals. We can really drive their understanding and promote it. So the main objectives, I've touched on some of them already, to significantly increase the extra care housing units we have over the next 5 to 10 years, identify potential sites and engage with specialist housing developers and our own development company to make sure that we can build in the places where we can meet needs best. To really consider extra care villages, so the larger developments that will have 200 to 300 units of accommodation will be part of a much wider community that will have housing that can meet the needs of families, people who are single parents, because they're the workforce of the future. They're the workforce that we need to access to support these schemes. And if you build something that's got a much wider community around it, then you can really hopefully have a successful scheme. And extra care villages are quite popular in other parts of the country. We've not really nailed that yet in BCP council area, so probably an area we need to focus on. And ensuring the best use of technologies I've described to promote independence and support the wider well-being of people. And that social care workforce that has the right skills and competencies. So extra care housing is different than just going in and just going into the wrong phrase, because it's really important people are going to other people's homes to give care. So domiciliary care, it's enhanced domiciliary care. They'll meet a greater level of need. They need to think about how they can work with the housing provider around tenancy management. How can they support people to access other services that are in and around the extra care scheme they live in. And that is a very rapid run through what's a much bigger strategy, but hopefully gives a flavour. And Chair, questions?
Yes, thank you, Councillor Johnson.
Thank you, Phil. You said about building about another 1,000 units. My thing is, I'm really concerned about access to outside space, you know, especially during the pandemic. A lot of the stuff that we build, it seems to have no way of letting the outdoor in, you know, and I think people need a bit of greenery and a bit of a garden to be able to tend, to give them a connection with nature. So you said earlier that you're working closely with planning. Would that be something that's considered within the design of these places?
Yes, absolutely, and not wanting to preempt any decision that Cabinet might make and any recommendations to the committee. I've already met with the head of planning to just set out the kind of broad criteria. If we wanted to build an extra care village, as an example, can we build it with some parkland or some access to green open space, green spaces within and around it, and create space between the buildings. And you know, we've got to think about the economies of scale. So it costs more to build extra care housing than just to build general needs housing generally. But what you get is the wider benefit. So I've built schemes in the past where there's a multi-use games area next door, that there's greenery, that there's an area where the residents can do some gardening, where there might be sensory gardens with herbs and perfume flowers, so they can walk through that and get that smell, and somewhere to exercise. So exercise is key. So areas to walk around, do some gentle exercise. Some schemes have gyms in them, and hydrotherapy pools, so they can draw people in from outside as well, because it shouldn't just be for the residents of that community. We want people to come in and enjoy the facilities, but be part of the community, so you get that interaction, and particularly around intergenerational links with families and schools around the about scheme. So absolutely open spaces, green spaces. I think the portfolio holder, if she comments, would say she would like a duck pond, or areas where there's other things that attract your attention you want to be part of. So absolutely.
Just on that point, I saw a programme with someone, it was somewhere in Poland or somewhere like that. It was a huge unit. They all had balconies, but they had a pool in the roof, a swimming pool, and all these people were swimming. It was great. So.
Thank you. Councillor Trent?
Yeah, thank you. Yeah, I would totally go along with the comment about having green space, garden space, or access to open space. And actually, some of the areas that I referred to earlier on, without being specific about them, are ones where there are planning limitations on them because of the closeness to Heathland, and something which you can build under these restrictions is facilities that are largely care. And I think during the pandemic, it was just so important that people had somewhere to walk or go to. People who had garden space around them were, generally speaking, healthier than those who were living sort of, you know, shoulder to shoulder. And so I think that in your conversations with planning officers, I think some of these sites almost leap out in their own right, you know, that are on public transport corridors, that there are limitations on the development, so you won't be competing with a developer hoping to make a fortune out of sticking a couple of blocks of flats there or something. So it may actually be financially more achievable to put a big development in some of these areas than trying to sort of fit them in other areas where you're in competition with commercial developers. So yeah, I think that is a good line to take, and I think it's a good it's a good thing to want to achieve. And I think there are some sites that automatically lend themselves to this kind of purpose because of where they are and the limitations that exist on them otherwise.
Chair, if I could just respond that, and thank you, Councillor Trent. Yes, I agree. We will look at those sites. I just wanted to say to make members aware, and you'll see it within the strategy, that there is economies of scale. So you would generally not build extra care housing schemes with less than 40 or 50 units, because that the economies of scale running the care and support elements. So having staff on site 24 hours a day is quite expensive. So you need that kind of economy of scale. So that sometimes restricts us. What it doesn't restrict us is from smaller bespoke units with people with disabilities or other vulnerabilities, where we might want smaller schemes as well. So we'll look at all of the schemes that that are designated for this kind of development. Thank you.
Councillor Evans.
Thank you. Firstly, I'd like to say I think this is absolutely brilliant. I think this is really making progress as to how our elderly population are going to be cared for and looked after in future. And I think it's really, really positive. So thank you for that. I think it'll also solve some of those issues about social isolation of people living in their own homes and only seeing someone for 30 minutes once a week, which is just so sad and terrible for them. As well as the outside space we've already mentioned, I'd like to put a plea forward for pets to be accommodated within these schemes. I'm sure if you've heard of the Cinnamon Trust, which work with elderly people who have to go into residential care and often end up having to rehome their beloved pets. I'm certainly aware of numbers of patients of mine who've declined hospital admission because they're so worried about someone looking after their cat or dog. We're a nation of animal lovers, and I think it's really important that that's remembered. Finally, I just wanted to ask a bit more about suitability for people with both physical and mental health needs. Obviously, our incidence of dementia is increasing exponentially, and these residents may prove more of a challenge. So I just wondered how we're going to accommodate their needs, as well as keeping other residents safe, which can be a huge issue.
I think the key to that, particularly around dementia, is making sure people make the move at a time when they are still able to recognise that their environment's changed and they can become more used to their own environment. Quite often the challenge with people with dementia is the change upsets them that much that they can't settle, and they then become more disruptive, and because they feel that they're in the wrong place and they want to go home, and I know you already know that, but so if you make the decision at the right time in your life, so it is a lifestyle choice to go into extra care housing. It isn't just a care choice. It should be made at the right time and sooner rather than later. So if you're starting to develop a condition or your loved one's developing a condition, you might want to consider making the move whilst that's still developing rather than when it becomes really advanced. We do have a specific extra care scheme in Bournemouth that is for people with dementia. I'm fine with that, although I'm just a little bit reluctant to badge something as a dementia only scheme. I like the idea of a mixed, because we could all be affected by some level of dementia as we progress into older age, and that therefore we shouldn't just box people into particular compartments. I feel it's a good scheme. I'm not knocking the scheme. I think it's just about how do we make it a more inclusive scheme where people recognise and it becomes less of a stigma. People are quite often stigmatised that have dementia or for other mental health problems, or it's indeed learning disabilities. So we've got a successful scheme in Poole that has a mixture of younger adults with learning disabilities, autism, some people with mental health problems, including dementia, and older frail people, and they live quite happily together. Wasn't always that way. It didn't start off that well, but over time it's settled down and it's really successful now as a scheme. So we can do it, and we've proven we can do it. I think the other key thing to mention is that there should be a choice around the type of tenure, that it shouldn't just be that you need to be in a social rented property. If you have money, then you might be willing to sell your property and make the choice to buy a property in an extra care scheme, which in lots of ways helps offset the development costs. So the capital money is put in by the purchaser, and you can have shared ownership where you own up to 50% or more of the property. And there are very successful schemes around the country where we can evidence that. So I think the world's our oyster in lots of ways. If we sign up to this strategy and really go for it, we can do a lot of exciting stuff, as you say, Councillor Evans, and I think this is one of the things that can really make a difference to people's lives.
Thank you. Councillor Andrews?
Thank you. You've mentioned earlier on that you're having sort of informal discussions with the head of planning, and probably Mark Axford, who's dealing with the local plan itself. In your report, I'm looking at paragraph 12, where you've listed a number of items, the Roman numerals 12.2, 12.6, 12.9, they all link into what might or might not appear in the new local plan, because obviously linking what Councillor Tony Trent said, that there is an awful lot of potential sites which are affected by the Heathlands ruling, whereby yes, accommodation such as this would tick the box. And you know, as a champion for adults in social care, are we able to make formal submissions to the local plan, or has it got to be all informal? Obviously, there's been a couple of brilliant ideas from the floor this evening about pets, about being adjacent to a lung of open space. You know, are we actually able to sort of put something down to the planners so that when they're doing the local plan and it goes out for public consultation, this aspect can be incorporated?
Thank you. Not wishing to steer committee in any particular direction, but perhaps it's one of the comments or recommendations committee might make in terms of the comments they make around the strategy that goes forward to cabinet, that you would wish for this to be incorporated into the local plan. I think we can make that happen anyway, but any support that members would wish to give would be gratefully received.
Well, I might need some assistance from you on the wording, but I would like to make a recommendation to the cabinet that you know, as a council, we do look to incorporating something in the local plan which, you know, supports adults wanting help in social care, because yes, it's something that it's an area where people choose to retire to. Often, for goodness sake, you know, Bourne started off as a TB area in the late Victorian era. It's an area where you know, we should be supporting this sort of thing. I would like to propose that we make a recommendation that the cabinet make some submissions to the local plan on adult social care provision.
I'm happy to second that, Chair.
Yes, did you want to actually write something down for Joe to take, so we can take this recommendation and we can perhaps have a vote on it? I mean, actually, it was a question I was going to ask about, was this part of the housing strategy, or was it actually in the local plan? Because I think it is actually mentioned, isn't it, in a paragraph in the local plan. But I think it's very important that we are considering these different forms of accommodation for different ages, and so that couples can stay together, you know, sort of something like that as well. And you did answer one of my other ones, was whether people could actually buy these flats, little houses, or whatever they're going to be, not just have to rent them. So if you want to send that across, Councillor Andrew.
Well, I've got something written down. I think probably that may have to happen between now and it going to cabinet is perhaps obviously a discussion with the appropriate planning officers, because obviously if we're recommending something which is unworkable or impossible, then, you know, it's going to fall flat on its face. But you know, it's quite simple. You know, cabinet to be asked to make submissions to the draft local plan as regards the provision of adult social care accommodation. As I say, it may require some manipulation of the wording when it's actually put to the cabinet, because obviously we don't have anybody from the planning section here. Yes, the cabinet to be asked to make submissions to the draft new local plan as regards the provision of adult social care accommodation. And as I say, as a rider on that, obviously it may need some liaison between the planning section and your good self as to what should be the final recommendation, which Shoni will have to put forward. Thank you. Can you repeat that? Sorry.
Just to amend it to say extra care housing.
That's fine.
Just to clarify.
Has anybody got Councillor Butler?
I was actually going to recommend something as well. There was something listed as an idea in the report, which I think is excellent, really. It said to use planning legislation to require developers to make provision for extra care housing as part of wider schemes. And I think that could help a lot, because if developers are building anyway, if they're going to include extra care housing as part of that, I think that would be really useful on both sides. It doesn't talk about numbers of units there, but that's actually on page 81 of the notes. But it would literally be the same wording as is in that.
Yeah, I don't think we could say numbers of units, because we don't want developers to have to build X number of units and find that they're vacant, you know, that they can't fill them. I mean, I would imagine it would be supply and demand almost with things like that. So I think you could say you can put in the extra care sort of housing, but not say that you have to build X number per year, because it would fluctuate. But Councillor Sanders, did you want to come back?
Yes, no, I was fine. I think that's a very good illustration of what can be done. You know, in my ward, we've got an application whereby, yes, a very small care home within a site for several hundred houses is planned. And actually, I don't think it is planned to be 45 units, so it's probably going to be uneconomic. They're going to come back and say, nobody wants it. Can we now get permission for some flats instead? Because it's 25 units is too small. So, you know, key information like minimum of 45 units means obviously a site of a suitable size needs to be marked out in the local plan. And we don't want sites to slip under the radar and end up as housing because they're too small. Things like that. That's detail, of course.
Yes, Councillor Butler.
Sorry, I had another couple of points really on that. There was something that said the point about 45 units, and we were talking about green space as well. A design that could work is more like a courtyard idea, where you haven't just got one massive block like an institution, but you have 4 sides with a green in the middle. And that could be a nice way of building that many units, which is quite a lot of units in one piece. So maybe to consider that style, which could be used. And the other thing was there were opportunities to go into partnership with specialist housing providers. I mean, I'm thinking of people like Mencap Homes, who have run some excellent homes for people with learning disability. And I think that is a great idea to get people who really know the specialist field that they are in and know what the people need in each home, and would obviously train the staff accordingly. And that could really work well. So I don't know how long our list is of specialist providers, but I think that's one to really follow up.
Thank you, Councillor Butler. Councillor Trent, did you have a question?
Yes, thank you. It's a couple of points really on what we've been talking about. If there was such a development, I think actually having houses for out and out sale or homes for out and out sale within such a development could be complicated, because then how do you deal with succession and things like that? For lease maybe, and you know, you could probably have quite a good system that would work well if you had you know, people could buy leases on it, so it's theirs, but it doesn't sort of end up in some sort of out of the scheme type of thing. The only other thing was a bit of a health warning actually, because we mentioned about pets and so on. But of course, if you were within 400 metres of Lowland Heath, which is where some of these areas are, keeping pets, or at least keeping cats, is one of the reasons why there are restrictions on the use of these sites. It's to keep pets away from the heathland and so on. So, although, as I say, the one area that's in my head actually has got a little bit in both, so you could possibly have part of the development where people could, other ones you'd have to ban the pet cat or something, or you'd be in contravention of the planning rules. But just a couple of health warnings on that I think, yeah, it's a great idea, and actually a mixed development where, you know, maybe it starts off owner occupier on the more free and open bits, and then it becomes more sort of restrictive as you get nearer the 400-metre area. You know, I think you could have quite an interesting development, particularly, you know, the sites I've got in my mind that are going to be a problem for planners. But yeah, just got to be a little bit careful about the ownership side of it, and how far you go with the keeping of pets. I think it's cats they're worried about. They're not worried about dogs. So, you know, you could probably have dogs within the 400-metre, but it's additional cats, which I think the English Nature and so on are worried about. But yeah, just a bit of health warning there, that's all. But, you know, I think otherwise it's a good idea, and it's really something we should be working on, because the one thing you can guarantee is that there are going to be more and more of us in that type of situation that sort of need to be in this halfway house type of thing than there ever has been, because the boomers are only just really coming on board now. You know, it's, you know, it's sort of a, you know, we're just catching up with the sort of time.
Thank you. I mean, Phil is not our legal expert or our planning expert, but I don't know, did you want to make any comments on Councillor Butler or Trent's remarks there? And I think Karen Rampton, have you got a question?
No, it wasn't a question, Chair. Thank you for allowing me to speak. It was just to say I've been listening to everything that's been said, and it really is music to my ears. This is an absolute passion, and I have a vision, and Phil and I have a vision, and it's about providing homes which are mixed tenure for people of mixed abilities, and which is a home for life, or as near as we can. And it certainly would have green space, and Phil jokingly referred to a duck pond, because I did say to Phil I would want water as well. You know, it has to be somewhere where there's access to space for people's health and well-being. So I'm really, really pleased that committee sounds as if they're going to make a recommendation to Cabinet, and I can just say that you are pushing out an open door with me. I can't speak for my Cabinet colleagues, but I'd be really interested to have this discussion when that recommendation comes forward. And I believe Phil and I are going to go and look at a couple of schemes which are already in existence, and get some ideas of some really good practice that they've had in other areas. So that was it, Chair. Thank you. Just to say thanks to the committee for their positive comments.
Thank you, Councillor Rampton. Phil, did you want to add anything?
No, I think Councillor Rampton's really summed it up rather well. Really helpful comments from members. We, you know, we'll take all of those things into account, including the specialist providers element. I think unfortunately, these things take quite a bit of time to get going, because when you get through development, but we really want to, assume we get Cabinet approval, to really accelerate the process to identify the right site or sites, and get some of these developments going.
Thank you. Did you want to read a recommendation, Joe, and then we'll see if there's any objections to it?
So Can I have confirmation that the audio is now working, please?
Yes.
Yeah, that's lovely. Thank you very much. I'll start again. I was just going to say that in relation to the wording of the recommendation, I wondered if the mover and seconder wanted to include any reference to working with the relevant officers in both planning and adult social care in order for the best input to be made to the local plan working group. Is that something you'd be happy with, or?
Yes.
Okay. Sorry, I think we're having some problems with the audio, but so just for the final time, I'll read out the recommendation, and if the mover and seconder can just once again nod and let us know they're happy, Chair, I'll allow you to see if members are all in agreement. So the recommendation reads as follows: this committee recommends that Cabinet, working with relevant officers in both planning and adult social care, be asked to make submissions to the local plan working group regarding the provision of extra care housing accommodation. Lovely. I'll hand over to you, Chair.
Can you hear me now? No. Yes. Okay. So, oh, there's lots of yeses coming up. Yes. Yes. So thank you, Phil, for your strategies and your market position statement tonight. You can take a little rest for a few minutes. And thank you, committee, for the recommendation and all the comments on the last few agenda items. So we're going to move on to agenda item 10, which is the Disabled Facilities Grant. And I believe we've got Tracy Kybert, who will be leading on this. Is that right? Yes,
that's
so
right.
Tracy,
Thank
over to you.
Thank you. Good evening, everyone. I'm here this evening to introduce our new draft Disabled Facilities Grant Policy, or DFG policy for short. This will be the new policy aligning the legacy council arrangements, and we're required to have in place under our statutory order. Since I submitted the papers for overview and scrutiny, the CMB have now met, and I can confirm there are no requested changes to the policy as a result of their feedback. To explain briefly, a Disabled Facilities Grant is a means-tested grant available to eligible residents, adults and children, to fund adaptations to their home. It facilitates people remaining independent for longer and living in their own homes for longer and keeping them safe and well. Typically, this will include things like level access showers, widening of doorways, installation of a stair lift, for example. The policy sets out the national mandatory guidance, but there are two main changes to the delivery of this scheme as a result of the proposed new policy, which I wanted to highlight to the committee. One is the introduction of discretionary funding, which we've not had in place before, and will mean we can exercise our powers to use funding flexibly to meet applicants' needs over and above the statutory guidance. So this will be for things such as where costs are over 30,000 and the applicant cannot cover the difference. Relocation, where a property may not lend itself easily to adaptations, or another property may be more sustainable, so we can fund the costs for the move. Essential repairs, where the applicant has not had the money or wherewithal to carry out maintenance on their home in the past, and in order to carry out an adaptation, an essential repair may need to be done first to make it safe before the adaptation can be completed. And complex cases where The solution may need to be innovative and outside the statutory guidance in terms of costs and what usually would be funded under the mandatory guidance. And the council recognises that the outcome will benefit the applicant and potentially reduce costs in other areas. Secondly, we have set out the commitment to utilise Seascape South Limited, our wholly owned company, to carry out the works as part of a comprehensive in-house service. So they currently deliver the majority of adaptations in the Bournemouth and Christchurch area, whilst Poole historically have used an advisory list of contractors. So we're proposing that in future all residents would be given the option to opt for this service, and the advisory list of contractors would be called upon only where the applicant chooses this as an option, or it's a specialist provision, for example, a lift installation or complex works where we may go out for a tender process. I think it's important to point out that the new policy is a positive move towards fully utilising our funding from the Better Care Fund, which has increased in the last few years, and to maximise the use of this for our residents in the BCP area. We will have a new grants team in place shortly following smarter structures, and this gives them a flexible policy to work closely with social care and SEND colleagues to meet the needs of applicants. And with the new team and policy and procedures all being rolled out, this will take some time to settle in. And we've included the action plan at Appendix 3, recognising the development work and promotion of the new service, which will be required across BCP. I think those are the main points I wanted to cover. So I'd welcome comments and feedback on the papers. Thank you.
Thank you, Tracy. Members, have we got any questions? Councillor Andrews.
Oh, I can't hear anything. Sorry.
Right, is this one any better?
Oh, that's it. Yep.
Oh, get me notes on.
Okay.
Right. At the £30,000 threshold, obviously this is a recommendation going to Cabinet, whereby obviously that can be potentially exceeded over that amount. And in the report, you know, I was wondering where this extra money is going to come from. Obviously there was an underspend last year, so we've got a bit of spare money in the bank, as it were. And obviously being discretionary, we can say to people, well, we run out of money. Sorry, that's it. You know, first come, first served. This £30,000 we're told was set in 2008. Well, building costs have gone up by 25%, 40,000. It's actually quite bizarre. In Wales, it's 36,000. In Scotland, they don't do it. Northern Ireland, it's 25,000. So it really begs the question, you know, why hasn't it gone up? Now, building costs due to the pandemic, other things have shot up tremendously. So that increase of 25% is probably out of date. You know, I've got some figures here which were published last week. Buying some stud 2x4, which is used for stud partitions, which might be used in building an extension, have gone up by 400% past 12 months. Steel's gone up 275%. Plumbing, copper, 175%. So I think I'm more than happy for this to go forward to the Cabinet as a recommendation, because obviously it will assist people to get these extensions or adaptions, ramps and things like that. But I think going beyond that, I know other local authorities have done this, have already beaten us and taken on this ability to exceed the £30,000 threshold. But I really do think that, I know we've got all these other things as a nation that we're meant to be spending money on, that serious thought needs to be given to increasing that 30,000, perhaps, you know, getting it close to what Wales are doing for people. In recommending this, and I propose a recommendation that goes to Cabinet, I would really like our leader perhaps to lobby the local MPs to see whether some small increase in that threshold can be made. The reason of that is that if that happens, we will then get match funding. We don't then have to grab some money from somewhere else, play areas or other facilities, to, you know, catch up with this funding. So I really do think that and this is a government decision, this £30,000 threshold needs to be increased. Thank you.
Thank you. Okay, so the discretionary powers that we talk about in the policy, the funding for that won't be taken from elsewhere. We actually have grant provision. So it's just allowing us to have the powers to use it over and above the mandatory guidance. So in the legislation, it's very clear that the funding up to 30k needs to be used in a particular way for set things specifically, such as ramps, access to from the building, etc. So the discretionary powers allows us to use the grant funding that we have at the moment that we're not utilising for things over and above that. So the policy is proposing that there will be a panel in place that will discuss cases where the costs are over £40,000 and where the recommendations may be that actually we want to go that bit further than the legislation sets out. So one example that's quite high profile at the moment is children with autism, where they have sensory needs. If you stick strictly to the DFG guidance, you wouldn't fund extensions for relaxation rooms, sensory rooms under the mandatory guidance and using up to the 30k limit. Whereas these discretionary powers would allow you to look at those needs and fund those sorts of facilities as well over and above the mandatory guidance. So the proposal is not to use additional funding from elsewhere. We're receiving that grant funding at the moment through the Better Care Fund, and it's allowing us to use it better. I hope that explains it.
Oh, just as a quick comeback, I'm sure it would help if that threshold was increased, because it seems ludicrous
Absolutely.
That something set in 2008 is still in place. Should train fares stay what they were in 2008 and things like that? Should council tax?
Yeah, I think to reassure people as well is that there are some fairly everyday adaptations that happen that don't cost anywhere near the 30,000 mark. The level access showers and the ramps in and out of the properties, which for some people actually enables them to continue living in the property. They might come in only around £7,000 or £8,000. So there are lots of our sort of everyday ones that are less complex where we don't reach those sorts of figures. But absolutely, you're right that one of the very reasons that we've requested it is around the building costs increasing.
Okay, Councillor Andrews. Yeah. I think she's saying that it's not sort of 30,000. You don't get a penny more. I think each case is taken into consideration, and they may spend more money on certain ones.
Oh, sorry, the mic's gone again.
Councillor Evans.
I can't hear anything. I'm really sorry.
How's that?
Yes.
Yeah. So just to support what Councillor Andrews was saying, I think we're more than happy to allow discretionary funding for things that aren't mandated. But I think it is really important that we do lobby government to get that limit raised. I mean, it's not been looked at for 13 years. Everything's increased massively. And I'd like to second the recommendation that we do lobby Her Majesty's government to get that reviewed. Thank you.
Councillor Andrews and Councillor Evans, I would just ask you to clarify the exact recommendation that you're asking the Chair to take to Cabinet on this. Thank you.
Can you hear me? That's the first question. Right.
Yeah.
Yes, good. That we recommend that the Cabinet or the leader be asked to write to the local MPs asking them to lobby the appropriate government minister to increase the £30,000 discretionary funding threshold to allow for inflation. And it,
Not necessarily with inflation.
well, okay, to review the £30,000 threshold in line with inflation and
Could we just leave it at review the amount? I think keeps it. Well, yeah.
Thank you.
Any more questions, Tracy? Councillor Butler.
Yeah, can I just ask if we're going to use Seascape South Limited, hopefully they must be quite a cost-effective company. So hopefully that might keep a bit of cost down labour-wise, for sure. Is that right?
To a schedule of rates, a national schedule of works rates for standard adaptations. However, it is something that should be continually reviewed. And I think as we're opening up the service delivery to the whole of BCP, it's something that we will look at more closely to ensure that.
Yes. Another question? Yes. Yeah.
I'm really sorry, I can't hear now.
Can you hear me now?
Yes.
Yeah. It's just I was a bit bothered because sometimes when council work is carried out, sometimes because council is paying, some contractors increase their amount of money. They might not actually charge that to a private customer.
All right, okay, thank you. In terms of external contractors from the advisory list that I mentioned, they will submit their costs, and as part of the grant procedure, we go with the most cost-effective quote.
Thank you.
Councillor Trent, you got a question?
Right, yeah, it's just carrying on from that because I think that having an in-house contractor is useful to us. I think it perhaps might hold other people back from costs. I've actually experienced the inflation of the cost of having something done if they think it's being paid for by a local authority. I've actually experienced that and caught them out. And in this case, nothing to do with building work or anything. It was times as much that they were seeking because they thought it was going to be paid for from a local council fund. But on this particular thing, the biggest problem is material inflation, because some building materials are as rare as hen's teeth. Try getting a tub of ready mixed cement or anything now. That and that and copper and things like that. That's where the real inflation is, and that is why I think the proposal is so important, that we need to take account of all of that, because it's absolutely ridiculous how much things have suddenly started to cost. There must be a lot of people sort of stripping the market of materials by going all out, do it yourself or something. But I remember looking for a simple 5 kilogram tub of cement a few times over the last 18 months or so and finding it nearly impossible to find. And when you do find it, you know, the cost was beginning to creep up on it quite significantly. So, yeah, you know, we do need that to be taken into account when it comes to money that's available to people, because you know, if you needed a shower put in, sort of thing, if you use copper piping, you know, straight away you're in trouble.
Okay, thank you.
Thank you, Councillor Trent. Has anybody else got any questions? No? Okay, thank you, Tracy, very much for your time on that. And
Thank you.
we'll move on to agenda item 11. We've only got one portfolio holder with us, and that's Councillor Karen Rampton. I'm not sure whether you're going to give us an update, or would you just like some questions from members? Karen.
Hi, Chair, thank you. I haven't really got anything that hasn't already been sort of said. What I've been working on, obviously with officers, are the strategies that you've been hearing about this evening. And Chair, you already mentioned the very successful seminar, all-member seminar the other evening, contact centre, and I think people find that really interesting. If anybody wasn't able to attend but would like the slides, they're certainly available, and they can be sent on. I'm happy to take questions, but I haven't really got anything formal to report.
Councillor Trent.
Yeah, it's something which perhaps doesn't come entirely under the portfolio holders area, although I suppose it does loosely. And that's that we had figures today which indicates that the BCP area is second highest in the region and above the national average for COVID case. I think the rate was 500 and something per whatever the statistic is, which is actually quite a horrendous figure. I think only Southampton was in a worse position to us, which worries me because next Monday I'm going to Southampton, but you know, in a confined area. But I wonder whether there are any additional measures that are likely to be taken to take into account those high transmission rates, because we do seem to, you know, it seems to be getting worse. I noticed today in something totally different, Dorset County Unitary has actually put all meetings back into virtual format if there's no decisions to be made. I would dread for that to happen again, because I can't cope with these virtual meetings because the equipment doesn't work. But, you know, I'm just wondering whether there are any sort of extra measures being thought about to cope with us, for obvious reasons, because it's got to be to do with holiday makers and tourism and so on, for the tremendous high rates that we've got.
Chair, I'm just conscious that we don't either have Sam Crew, the Director of Public Health, or the portfolio holder for COVID resilience with us this evening. So I wouldn't want to speculate. I think it's probably better to put the question in written form to Sam and to Nicola Green.
Yes, I was about to say the same. Unfortunately, both of them are not here at the moment, so wouldn't bear to answer that sort of specific question. But we have got a very high rate of vaccinated people, so we have to sort of be pleased about that as well. Has anybody else got any questions for Karen? No. Thank you, Karen, for your time.
Thank you, Chair and Committee.
Thank you. So move on to agenda item 12, which was the BCP carers review. Now, we did hold our first session, was it last week, LJ? All the weeks are rolling into one at the moment. And it went well, and we had a preference that we didn't set up a formal task and finish group. We decided we would much prefer to have a more informal one involving all those members that are interested and external consultees. And I'm hoping that Health Watch here will be one of those that we will take input from for the development of our carers strategy. Louise, are you wanting to speak?
Just to say, I'd be happy to take part.
Thank you. Has anybody got any questions or anything on this? We'll let you know when we're going to have the meeting and how the strategy develops, if that's okay. Yeah. Okay, so can we move on to our forward plan? Right, we're all on the page there. So our next meeting is the 27th of September, where we should have a Safeguarding Adults Board annual report and business plan. And we'll get an update on the progress of the objectives for 2021 and the board's business plan 2021-22. So that's the next one. And we'll also have a report on the adult social care charging strategy, and that will be embedded now, won't it, sort of from when it was all harmonised with all 3 towns. And then we've got also a Health Watch Dorset update. So that will be you, Louise, and you can give us an update on the work of Health Watch and your ongoing projects. Could you just remind us again of the projects that you're doing this year? Is that okay?
Yeah, thanks, Chair. I was hoping to come along with a couple of our young listeners, actually, and our youth agency, because they'll have finished up most of their projects by then, so they'll be able to give you an update on what they've been talking to young people about, which I hope will be of interest. The other things we're looking at, we're looking to wrap up our vaccine survey at the end of August, so I'd have an update on the feedback we've had from that. We've had around 900 responses so far. We're going to boost the survey to some younger people over the next few weeks, and then produce a report in September, so I'll be able to give you an update about that at the same time.
Thank you, Louise. Yeah. And then we've got the Bournemouth Birth Centre, and this is going to be brought to us by Lorraine Tong, where there's changes to the birth centre between the Royal Bournemouth and Poole Hospital. So so can we add this to our forward plan? Yeah. Okay. And we've got a busy month. And our usual portfolio. I think the next one's going through into November. So if members can just look through what we've got going through November and the rest of the autumn. So we've got Dementia Services Review, we've got Home First Implementation Review, and the Carers Strategy. And then later on, we've got the Dorset Clinical Commissioning Group Mental Health Rehabilitation Service. We've got a review of the Safeguarding Community Safety Partnership and Liberty Protection Safeguards. And then I imagine these must be for spring next year. We've got the Suicide Prevention Plan to see how that's progressing. Now, the dentistry provision. Not sure how we want to sort of go along with this, as it is more of a national problem as well as a local problem. So do we want to have it that we write to our MPs? Have members had lots of complaints about dentists in the area? Councillor Jones.
You hear me now? Still there? Yeah, just this was something I mentioned obviously a couple of meetings back. I've had concerns raised with me by some of my residents, and on the back of that, actually an email came from one yesterday. I formally wrote to Tobias Elwood and obviously made him aware of the situation. I doubt whether it would be a surprise to him, to be honest. I dare say other constituents have raised it with him. And I'm waiting for his office to look into it and providing me with a formal response. But personally, I think it's something that he needs to take up with the health secretary or somebody with the health secretary's team, and also trying to get a direct response from them.
Thank you. I did find an excellent article by Health Watch on it's a very good finding a local NHS dentist. As I said, this is a national problem, and Health Watch it wasn't Health Watch Dorset, I think it was just a general Health Watch looking into the problems that people have sometimes accessing NHS dentists. So I want to ask, do we want to keep this on our forward plan, or is it more of a, we do? Yeah, yeah. Oh, Louise.
Thanks, Chair. I was just going to say that we actually, I think the inquiries that we I go along to a regional dental commissioners meeting for the South West, where I've raised local people's concerns, and we're about to ask our volunteers to actually call around all the dentists across Dorset, because anecdotally we haven't been able to find any dentists that are taking NHS patients at the moment. And I thought for the next dental commissioners meeting, it'd be useful if I had clear facts. So we're going to ask our volunteers to ring all the dentists and just check so that I can give them exactly what we're being told at the moment. So I'll be able to share that with you as well.
That would be really good. I think that would be very interesting, wouldn't it? We'd like to sort of hear that, yes, sort of the problems that people have with accessing the dentists. Okay, thank you, Louise, for that.
Thanks, Chair.
We've got Councillor Butler.
Yes, following on from that, as we requested this in March initially, could we actually put a date on that for the dentistry?
Louise, I don't know.
Sorry, Chair, I can't hear you.
So, Louise, this ringing around the dentists and this project that you're doing, would that be data be available for our September meeting in your update, or was it?
Yes.
It will be. Okay.
Yeah.
So is that all right? Yeah. Okay. Thank you, Louise.
Thanks.
So we have health service for people who are homeless and rough sleeping, and 111 and 111 first. I think obviously we probably move some of these around as reports and that come in. We've got the new adult social care emergency duty service and day opportunities. But actually, I just wanted to bring up one of our commission work that we could possibly do with Dorset Council, and that's the South West Ambulance Service Trust Improvement and Financial Investment Plan. Now, we know ambulances have problems with the winter pressures that come onto them, but being a resort area, they also have pressures from the vast numbers of visitors that we get. And I think if I could ask Joe to write to the chair of the Dorset Council Adult and Social Care to see if we can arrange a time for looking at the South West Ambulance Service, because I believe they are under a great deal of pressure at the moment with staffing, resources, and all sorts of things. And I think we need to sort of really have a look at this. I think it would be good for the committee to do this jointly with Dorset. Have we got any members that want to make a comment on? No. No. Yeah.
Thank you, Chair. Just adding on to that, in Democratic Services, we have been contacted by the new coordinator for health ONS committees at Dorset CCG. That's Rebecca Varndale, and hopefully in August we plan to meet to sort of discuss areas that have been identified for possible joint scrutiny, and certainly Chair and Vice Chair will include you in those, so that any areas of interest like the South West Ambulance Service can be looked at, and hopefully sort of a date and a relevant time be put into either this committee's forward plan or a joint forward plan between us and Dorset Council. Thank you, Chair.
Thank you, Joe. Sounds like a plan. Councillor Phillips, do you have a question?
Unmute. Can you hear me? Yes?
Yes, we can.
Yes, thank you. We've mentioned dentists, we've mentioned ambulances. I wondered, I'm hearing the difficulties people are getting for appointments at the doctors, and some people are actually ignoring and avoiding some illnesses they have, and actually arriving accident and emergency because they're not getting into doctors' surgeries. And I think that was also mentioned on the news recently. I wonder whether we should be analysing that as well as we've brought up the other subjects.
Thank you, Councillor Phillips. I'm sorry, going back to Health Watch again, but they did do a project on this, certainly during the height of the pandemic, when it was getting difficult for people to see their doctors, and not all people can cope with Zoom calls and all that. But that was right, wasn't it, Louise? You did this on accessing primary care.
We did, yeah, and it's one of our work plan items for this year as well, because as you say, Councillor Phillips, we are still hearing from people who are having trouble accessing their GP for face-to-face appointments. I think that it would be useful to put this on the agenda for a future point.
Thank you. That would be nice, Chair. Yes, please.
Yeah, put that. Yeah. One of the other things that I wanted to mention, because I haven't heard about it in quite a long time, is the Dorset Care Record. Phil, are you aware of this, or is this under David?
Chair, it is a joint responsibility. Yes, the Dorset Care Record. We suspended our activity with the Dorset Care Records at the start of 2020. We're still paying towards it, and our practitioners are still accessing the Dorset Care Record, but because of the changes to systems, LGR and having two separate children's and adults social care case management systems, until we get that updated, till we've got a single system, it's creating problems trying to upload the data. So it hasn't gone away completely, but yes, there hasn't been an update for some time. We're looking to re-engage in that programme probably in the autumn.
Okay, thank you. Can we put that on our forward plan? Yep. Councillor Butler, did you have a question?
Yep, just a quick question. I know what the 111 service is, but I don't know what the 111 first service is. Can someone explain the difference?
So 111 is for general health and advice. 111 first is for people who think they might need to go to accident and emergency to enable them to actually book an appointment rather than just turning up.
Thank you.
Anybody else got anything they want to put on the forward plan? No? No? Well, that's okay. Well, thank you very much, members. Thank you, officers, and Louise for attending tonight. And I think I'll close the meeting. Thank you, Joe.